Let's see now some of the accessory structures in the skin. The first one is the hair. And for the hair, it's basically made out of dead keratinized cells, also epithelial cells. Now, there are two areas of the hair. There is the hair shaft, which is the area above the skin, and there is the hair root, which is the area beneath the skin. And as you can see, most of the hair root is in the dermis, even into some of the hypodermis. So the hair shaft, we can say it's the area in the epidermis and above the skin. We won't go into the details of what is in this area or what types of cells within the hair root, but just understand that here there are stem cells that keep dividing, providing new daughter cells, and these daughter cells are being always pushed toward the outside or toward the hair shaft, which will cause the hair to grow in length. That's what we need to care about. However, we need to see a function of the hair. Now, the hair itself, or the hair root, is covered with something called the outer root sheath. This outer root sheath is a connective tissue. Now, on this outer root sheath, there are nerve endings. So, on the connective tissue, the outer root sheath, there are nerve endings. These are responsible for sensing touches through the hair. So if you move your hand over your hair, barely touch them, you will feel that. This is because the hair roots, they have like nerve supplies that will sense touch through the hair or any movement through the hair. Also, the hair in general would protect. So it helps like to prevent any trauma coming to the skin. So this is all for the hair. Now, attached to the hair, there is a smooth muscle called erector pili muscle. The erector pili muscle. And this is the smooth muscle. Now, this smooth muscle can sometimes contract, and this will cause the hair to stand up. When the hair stands up and this muscle contracts, it will stretch the skin. This will cause the pores of the sweaty glands to close. So when the erector pili muscle contracts, it will close the pores of the sweaty glands, and it will cause the goosebumps. This is important because it will preserve the temperature. It will preserve the heat inside the body, which is something we are going to talk about it also in a little bit. Also attached to the hair root, sebaceous gland. And the sebaceous glands, these are exocrine glands, since they have a duct and they are releasing their secretions on the hair. The main secretions of these sebaceous glands is oily material that's called sebum. So it will moisten the hair and the skin. Most of these sebaceous glands are associated with the hair, but sometimes some of them are open directly to the skin. Another important structure in the skin are the sweat glands. And for the sweat glands, we have two types. We have the eccrine sweat glands and the apocrine sweat glands. For the eccrine sweat glands, these are the most abundant, and these are the ones responsible for the thermoregulation. So when we feel hot, we are releasing sweat. It's coming from these sweat glands. These are exocrine, since they have a duct. And again, their important function is the thermoregulation, which will help in maintaining homeostasis. These are active from day one. So once the baby is born, they are active. They are immediately involved in the thermoregulation of the body. Then there is the other type, the apocrine sweat glands. These are located mainly in the area that are dense in hair, like the armpit and the genital regions. Whereas the eccrine, these are all over the body, like all over skin surface. But we can like find some areas like the soles of the feet and the forehead, the palms, they're abundant there. But technically they are all over the body. For the apocrine, they are only in the dense area. Okay? Also, and different than the eccrine, these are active only during puberty or after puberty. So they are not active from day one. So this is another difference. So the first difference was their location. The second difference that their active time. The third difference is the type of secretions. Over there, the sweat is basically water. Like a sweat, Usual sweat, 99% of it is water, and the other 1% like sodium, some salts. But here with the apocrine, we have organic compounds. Sometimes it's lipids, some oils, some proteins. All of these are coming from these apocrine. And these are going to be consumed by bacteria on our skin, and they are going to cause the smell. That's why that type of sweat is smelly, because the bacteria are consuming some of the materials produced by these glands. We already talked about sebaceous glands. We said these are producing the sebum, and this is important to soften the skin and the hair. Now let's see some general functions of the integumentary system: protection, sensory function, body temperature regulation, metabolic functions, blood reservoir, and exertions of wastes. Protection, we already talked about it. To protect against water loss, it's protect against UV light through the melanin. Also, it's act as a barrier to prevent microbes from getting in. So all of these are functions of the skin. We already talked about them. Sensory functions also, we sense through our skin, we sense temperature, we sense pain, we sense touch. And these sense functions are coming through specialized structures. Like we have the Meissner or the tactile corpuscle, which is here. We will see it in the lab. And this is for light touch. Okay. And then also we have something called Bassinian corpuscle or the lamellar corpuscle. This one. This is deep into the dermis, and it is for deep touch and vibrations. Deep touch, vibration, and the pressure. This is the lamellar corpuscle. Thermoregulation, we already talked about that sweat glands are responsible for reducing the body temperature. So this is one form of thermoregulation. However, there is another form of thermoregulation we need to talk about. That is related to perspiration. Now, we have two types of perspiration in our body. We have insensible perspiration that we don't see it, unnoticeable sweat. This is around like 500 milliliter a day, okay, during resting conditions. Then there is sensible perspiration. This is when you are working out and you see sweat coming out. Sometimes we are releasing 1.5 liter per hour for an active person. These sweat mechanisms are important in order either to release the temperature or keep the temperature. And this is related to how the blood vessels in the dermis are either dilating or constricting. So during a hot day, the blood vessels will dilate and they will allow more blood to go to the superficial layer of the dermis. So this will maximize the heat loss. This is when we have a hot day. However, when we have cold temperature, the blood vessels will constrict, and this means they will minimize the amount of the blood going to the epidermis. So the temperature will be preserved in the body. Now, for the body, there are more important organs than the skin to maintain, especially in a cold weather. Like, for example, we are talking about the heart, the liver, the brain. All of these are more important organs than the skin. So if someone is strained like in a forest during cold weather, they are at high risk of having like frostbite. What is a frostbite? It's literally that the blood is shut off from reaching their limbs. Initially, it will start by not reaching their skin, but as the situation worsens, the body would keep shutting blood from any area that is less important comparing to the important organs. So it will start shutting blood from the fingers, then from the wrist, then from the arm, and so on, in order to keep the body warm, or these important organs warm and alive. Now, another aspect is also related to something we talked about, which is the hemoglobin. Now, why a cold person, their skin would appear much darker than someone who is not cold? Again, because here there is less oxygenated blood coming to the skin. That's why it will appear like a blue. Another function of the skin, that it synthesizes vitamin D. The skin will start synthesizing vitamin D when it's exposed to UV radiation, like normal sun. And vitamin D is important because it will help in absorbing calcium from the intestine. So vitamin D will be produced by the skin, and it will go to the intestine to help in absorbing calcium. Now, deficiencies in vitamin D would lead to develop a situation or a disease called ricket. This is when the bones are soft due to lack of calcium. So the bones are soft that they cannot bear the body weight, so they will bend, as you can see on this x-ray. They will bend. Why? Because they are soft due to the lack of calcium. And this is a connection between the skin and the bones. So if there is a problem in vitamin D synthesis in the skin, this will cause the bones to soften. And this is a problem in areas where there is very limited sunlight, especially during winter, like northern regions of Alaska, of Sweden, of Norway, or like deep south of Chile. All of these countries, they will have problems during winter when they don't have enough sunlight to produce enough vitamin D synthesis. The last thing in this chapter is the burns. And the burns are damage to the skin by either heat, radiation, electricity, chemicals, or sometimes even like cold. Very cold temperature can cause burn. Here we are talking about damage that could be to the epidermis, or sometimes goes into the dermis, or even goes into the hypodermis. Now, regardless what type of burn we have always risks of dehydration, we have risks of electrolyte imbalance, and we have risks of sometimes circulatory failure, we have risks of infections. So all of these are risks associated with the burns. And the burns are classified by the degree of their severity. Usually there is the first degree burn that would cause redness to the skin. This is very painful, but it will be limited to the epidermis. It will take several days, sometimes 2 weeks, to heal completely. So any redness would be classified as the first degree burn. Second degree burn, you will have some redness, but also you will have blisters. Blisters are accumulating of fluid under the skin. These are painful, but they can heal by themselves. There is nothing need to be done regarding them. Just cooling them down, give some anti-pain medicines or painkiller, and that's it. However, with the third degree burn, which I'm going to show now, but be careful, the image might be disturbing to some of you. In a third degree burn, we are losing the epidermis. The epidermis is completely gone, and now we are having damage to the dermis, and sometimes even deep dermis. So for these third degree burns, you will have loss of nerve endings and sensory functions. That's why these are less painful. Sometimes they are not painful at all because there is no nerve ending to report the pain. Okay, now these are very serious injuries. Here we have risks of dehydration or water loss, and also we have high risk of infection because here you are looking directly into the inside of the body. We lost the layer of the skin that would prevent these pathogens from coming in. So this is the third degree burn. There is a fourth degree burn, also I'm going to show. Be careful with the following image. It's very disturbing. Now in the fourth degree burn, we lost the epidermis, we lost the dermis, and even we lost the hypodermis, we lost the muscles. We are looking into the bones. So at this point, there are great risks of infections. Okay, there are a great risk of developing gangrene. These are dead tissues, and usually this hand would be amputated because there is no hope of recovering these structures. Now, treatment-wise, for the first degree, second degree, or even the third degree, for the first and second, like painkillers, cool it down. For the third degree, usually there will be like some skin grafts and antibiotics to prevent infections. For the fourth degree, it depends on how bad it is, but mostly it will be amputation. When do we consider burn as critical? So, for example, if it's 25% or more of the first or second degree, that's a critical burn. If it's 10% or more on third degree, that is a critical burn. And when we say critical, it means that they need medical attention, they need treatment, they need to be isolated. Burns patients usually treated in a very sterile condition that is more sterile than operation room because their internal environment is open to the atmosphere. So it's very controlled environment that they have to be within it in order to prevent any wide or universal infections in their body. So that's it for the skin. Please write down your questions in the forum, and I will be checking there to see if there is anything needs more clarification.